Good afternoon. We're here on day one of ESVS, and I'm going to interview Blandine from France on the battle study. Okay, Maurel, would you like to introduce yourself to our audience? Tell us a little bit about where you're from and who you are.
Yes, so Blandine Maurel, I'm a Consultant Vascular Surgeon in Nantes, the University Hospital. And I work with Professor Drag-eluting, who is the head of this randomized study.
Okay. And so the battle study is a trial comparing a drug-eluting stent versus a bare metal stent.
Exactly.
Can you just explain a little bit more about why you did the study?
We did it because currently evidence are lacking to choose between devices, because most of the study compare drug-eluting device or bare metal stent to balloon angioplasty. So we decided to help with the choice doing this randomized study.
Okay. And your results have essentially shown no difference between the drug-eluting stent and a bare metal stent.
Yeah, we saw no difference between bare metal stent, self-expandable nitinol stent, and drug-eluting stent at 12 months in terms of instant restenosis.
Okay, and what is the importance of this results for us as a vascular community?
So we don't have the answer yet about the best strategy to treat task A and B femoro-popliteal lesions.
You think would be to use a bare metal stent? So what would your choice be based on battle?
So we don't have the proof that drug-eluting stent, at least the verpetix, is doing better than bare metal stent.
And I guess that would be important after the Katsanos paper suggesting that drugs might not be great for patients in the long run. If there's no difference, then perhaps it suggests we should stick with bare metal for the time being.
Yeah, exactly. So we can underline that in our study, we haven't found any difference in late mortality regarding the drug-eluting stent group.
So you saw no difference there, but I suppose
we observed more deaths in the bare metal stent than in the drug-eluting stent, and deaths were not related to the device. So.
Okay, so that narrative from Katsanos is probably not being borne out in your study, but equally, if there's caution, at least we're not seeing a big difference between bare metal and drug-eluting stents.
For now we don't have the answer, and this is the reason why we run another study with another paclitaxel-eluting stent with a polymer.
Okay.
So this is the eminent trial.
Delayed release of paclitaxel.
Exactly. Okay. To see if it's because of that.
So you think the timing of paclitaxel might make a difference to the comparison, and that's the justification for your next study?
This is the main hypothesis, yes.
So those are interesting questions now with drugs. As we see that with a lot of diseases. Should we use them? Should we not? And so what is your overall impression now that you've been involved in these trials? Where do you stand on the best drug and the timing? You're not sure yet?
No, we're not sure yet, and for the time being, as you said, for this lesion we use bare metal self-expandable stent.
Okay. So after these studies, what's your main message for people if they're looking at the battle trial and they want to take away a message? What do you think is the main take-home message for anybody from that study?
The take-home message is we cannot say for now that drug-eluting stent does better than bare metal stent in intermediate length lesion of femoro-popliteal disease.
Okay.
That's okay.
Very good. Thank you very much.